The opioid epidemic is personal to so many American families. In 2020, nearly 92,000 people died from drug overdoses, making it a leading cause of injury-related death in the U.S. And significantly, of those deaths, nearly 75% involved a prescription or illegal opioid. And as these deaths continue to climb, doctors and researchers are innovating to try to prevent them. This includes a Northwestern University team. They are developing a small, soft, flexible implant that relieves pain on demand. It's also dissolvable. This is a potential alternative to opioids. And Dr. John Rogers led the development of that device. He joins us now. Thank you so much for being here, John.
Hello. Hey, thanks for having me.
Well, Dr. Rogers, what is so interesting here is that there are no drugs at all involved. Can you tell us exactly how this works? How does this get rid of pain?
Yeah, it's based on a cooling effect. So if you've ever been out in cold weather without gloves on, you'll be, familiar with the kind of numbing sensation that develops in your fingertips. That's a general kind of process that affects the way that peripheral nerves operate. And what we are attempting to do is to kind of exploit that cooling effect, but deliver it in a targeted way to peripheral nerves that are deep beneath the skin, so that we can block pain signals associated with their source in certain regions of the body. So it's very directed, and it's based on engineering principles as opposed to drugs.
That's so interesting. And what is the timeline there? Are you able to control when it will dissolve or how long the patient will need this sort of relief for?
Yeah, so, pain management is a pretty tricky business. There's all different sorts of pain, chronic pain, acute pain. What we're attempting to do is develop a new technology to treat a specific clinical need, which is management of pain following a surgical procedure. So post-operative pain, where you might, have a patient that would experience pain over a period of a few weeks. So we designed the devices to offer that kind of cooling functionality over that time frame, but we build it out of materials that just naturally dissolve away inside the body, much like a resorbable suture in a sense, but this is a piece of electronics with microfluidic channels and so on to do the cooling and to measure the temperature at the nerve. So it's a little bit more sophisticated, but conceptually very similar to a resorbable suture in that sense.
Yeah, and that's really interesting because it's sort of addressing this really critical period of time, right? After a post-surgery, when very typically an opioid might be prescribed, and instead perhaps we could do something like this. I do want to ask, for those who are skeptical at the idea of something being implanted inside of their body, what would be your message for them?
Well, I guess we're thinking about this device in the context of a surgery that has to happen anyway. So the patient is already open. The surgeon has access to the nerves that need to be cooled and need to be, blocked in the sense of pain signal propagation. The other thing about the device itself is it's very soft and rubbery. It's almost like a rubber band, so it can conform very gently but intimately with the nerves without causing any kind of mechanical damage. And so as far as implants go, it's very unusual in terms of those mechanical properties and this capability for dissolving away. But it is an implant, and so we need to go through a regulatory process before we'll have a chance to use these devices with human subjects.
Right. So obviously, if this works, it can't come soon enough. But speaking about that, what still needs to be done? What's the timeline? And also, are there any side effects to this?
Yeah, so we haven't seen any side effects. It's totally reversible. So in a sense, it provides a switch and a dial around how you treat pain. So you can turn it on and off. You can dial up the magnitude of the relief. You can dial it back as necessary. And that's one feature of the engineering that we find very appealing. But I would say from the engineering standpoint, we're pretty happy with the device. Works very well. We've tested it extensively in animal models. But I think what we need to do now is do a deeper dive around the biological consequences of extended periods of cooling to see how the nerve responds. And we can do that work in animal models. And I expect that will be our emphasis the next 2-3 years. And we hope to move to larger animal models and then ultimately into humans during some subsequent time period after that.
All right, so still some time, but eventually, how much of a medical game changer do you think this could be? What is your ultimate goal here? And also, Dr. Rogers, personally, why is this important to you?
Well, we've been watching the opioid epidemic develop, and I'm a biomedical engineer, run a research group here with lots of really talented postdocs and graduate students and so on. And so we decided 3, 4 years ago that, hey, we need to work on this problem and try to come up with an engineering oriented solution that can bypass a lot of the very negative effects associated with painkillers that are used today. And so we hopefully will be able to make an impact, and we're pretty happy with the progress we've been able to make. But we understand that there's a lot of additional work that needs to happen. But we're very dedicated to this problem because we think it could impact a broad swath of the community.
Dr. John Rogers, I've been looking forward to speaking with you all day. Thank you so much for your work and the work of your team, and thank you for joining us tonight.
Thanks for having me.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.